Hi, Dr. Theodore. It's so nice to have you on the show. How are you doing today?
Good, thank you. Thank you so much for having me on the show.
Yeah, beautiful. And thank you so very much, Dr. Theodore, for honoring the invite. It means a whole lot. Thank you so very much. Okay, Dr. Theodore, I am quite excited to have you on the show for a couple of reasons. Firstly, my interest in knowledge seeking, because I believe in order to transition from a chaotic situation to that of a beautiful one, I believe that it takes the application of knowledge, quality information. And you see, Dr. Theodore, ever since I discovered that light in the Hebrew means knowledge and darkness means ignorance, I've been so keen to knowledge seeking because I do not want to remain in the dark. So that's going to make our conversation here today very, very important to me and even to the audience. Okay, now the second reason why I'm excited to have Dr. Theodore on the show is for the sake of the listeners. I believe there are some things that you know that some of the listeners needs to hear you say the stuff, directly from your mouth in order for them to get unstuck and experience transformation. I firmly believe that. And lastly, that is me again. I am convinced that I'm definitely going to learn one or two things from you, your story, your insight, and your experiences. So, for that reason, Dr. Theodore, let's get started with your introduction. Talk to us about your journey, how you got here. Then, afterwards, I've got some beautiful questions for you. Okay, Dr.
Great.
Theodore, over to you.
Well, it's a curious path, and I think the thing that defined how I approach my life is I read a book called The Structure of Scientific Revolutions by Thomas Kuhn back in college. It became my Bible. And what Kuhn taught is that the only way for change to happen is to break the paradigm, to break the common way of thinking. I've applied that in a bunch of different ways, but the thing that's most important now is that about a decade ago, I started working in the area of infrared light as a treatment. And the idea of light as a treatment is sort of mind-boggling to people. They can't get their heads around the idea that using light can actually heal the brain. It can actually speed the healing of wounds. And the effects are dramatic, and they're powerful, and they're safe, and you don't have to take a pill. So over the past decade, I've been working intensely in the area of developing infrared light treatments to treat the brain, not just brain injury or stroke, but also depression and PTSD. And now long COVID is a huge problem for many, many people all over the world. And there's no treatments for it. Well, infrared light treatment works on long COVID. We're also discovering that it helps autism. It also greatly relieves ADHD. So a mom doesn't have to give a child a pill every morning for them to be able to function in school. That's mind-boggling. So the possibilities of infrared light, which is now considered the fifth branch of medicine, I wouldn't say are unlimited, but they're vast. But there's a caveat. And my biggest message is that we must be careful about charlatans, about people who overrepresent what they can do. And that's why a lot of my publications in the field are calling out that distinction between what people can claim they can do and what they can show they can do.
Amazing, powerful words. You know, one of the set of people I love to speak to happens to be doctors. You know why? Because each time I listen to a doctor speak, I just usually find myself learning amazing, mind-blowing stuff. You know? Okay, so that's going to lead us to the very first question. You know, this is actually the very first time I'll be hearing about the how do you call it? Infrared red light, or how do you put it? I'm not sure if I pronounce it. Yeah,
Infrared light, yes.
yeah, infrared light. So I want you to talk to us more on this stuff. You mentioned how the stuff heals things, and I want you to talk more on it. How did how did it all started? Can you take us back to the original? How was it discovered?
Um, sure. So infrared light is actually a fairly broad spectrum of light. It's everything from visible light, the top range of our visible light, what we can see, up to microwaves. So it covers this very broad range of light frequencies. Now, some of these frequencies don't do anything naturally, but some of the frequencies are able to activate processes within the body. And so there's certain specific wavelengths that activate the mitochondria within cells. Mitochondria are those little organelles that make energy in our cells. And in neurons, brain cells, they're packed with mitochondria because neurons basically their job is to make electricity. So they're burning a lot of energy and they need a lot of energy. So certain wavelengths of infrared light, if they can reach the neuron, will activate the mitochondria. The mitochondria makes more energy, but it also starts sending signals to the DNA of the cell. It sends signals saying, start making these growth factors, start making these anti-inflammatory factors. So as a result, infrared light reduces inflammation and it turns on growth factors. Now, what do growth factors do? Well, there are many different growth factors, but just staying with the brain, there's one called brain-derived neurotrophic factor, or BDNF to its friends. It happens to be what I did my postdoctoral research and had my first 2 NIH grants working on. So I know BDNF very well. We're old friends. BDNF is the driver of neuroplasticity in the adult brain. In other words, it induces brain repair. Now, if you have a brain injury, that's great. But depression is also a form of brain damage. Anxiety and PTSD are forms of brain damage. Toxic exposures such as COVID is a form of brain damage. And all of those things can be repaired with infrared light.
Amazing, amazing. I got that. Okay. So let us talk about depression. You mentioned depression. Can you help us understand how the brain really changes in depression?
That is one of the biggest gaslighting jobs in medical history. We've been told all this time that, low serotonin is what causes depression, and we just have to raise your serotonin level. So here, take this SSRI to raise your serotonin levels and you won't be depressed anymore. Well, there's a problem. That was a theory and a marketing gimmick made up to justify how the SSRIs worked. They had no idea.
Ooh.
They said, well, maybe we're increasing serotonin. Maybe that's the answer. But it's not. It's not the answer. In fact, there have been now 4 huge studies, what are called meta-analyses, that look at all the research on serotonin and depression. Basically, there is no relationship between serotonin and depression. What actually happens in depression is that parts of the brain are degenerating. So the hippocampus, which is in our temporal lobes and regulates learning and memory and emotion, starts to shrink. And it can shrink as much as 50% in depression. The frontal cortex shrinks as much as 30% in depression. It also shrinks in PTSD. And so that's a degenerative process. That's synapses breaking down, that's circuits breaking down, that's dendrites crumpling up, that's neurons dying. And the SSRIs, the antidepressants, very weakly, very poorly, very slowly, if you're lucky, and Mars is in retrograde in Capricorn, then you've got a chance that the SSRIs will help your depression. But that chance really is about 20%. Now, if you turn on BDNF, that growth factor, and you turn on neuroplasticity, you can very powerfully reverse depression. There are two things that we know for sure does that well. The first is a chemical, ketamine. And ketamine has exploded on the world scene as a new treatment for depression. And, there are ketamine clinics all over now. I had the first ketamine clinic in Colorado. There's now hundreds. So ketamine powerfully turns on neuroplasticity and brain repair. You got about a 72 to 74% chance that it will help. Infrared light, it's so powerful that in our clinical study of depression, the response rate wasn't 20% like you get with Prozac. It wasn't 73%. It was 93% of our patients saw significant clinical improvement in their depression. So infrared light is a very powerful modality for repairing depression. Okay?
Wow. Amazing. Oh, man. I'm loving this. Very, very educating. Okay, you see, I'm so curious about this. I'm not so sure. Is it true that depression can be caused by infection? How true is that?
Yes.
Whoa,
Absolutely.
really?
Yeah. So one of the other revolutions that's going on in medicine, in brain medicine, is the recognition that infections play a big role in a number of disorders. So there's now clear, absolute evidence that herpes 1, the cold sore virus, contributes to Alzheimer's, not subtly, in a big way. So the treatment of Alzheimer's going forward must include treating herpes 1, the cold sore virus. In the case of depression, my work in the role of infections came about sort of circuitously. So you talk about how we all have these interesting pathways. Well, here's mine. So I started out working in neuroimaging, so functional brain scans, what are called SPECT scans. And I would get these patients who would come in and say, "Doc, I had a stroke. I must have had a stroke, because my brain doesn't work anymore." And I would look at their SPECT scan, and a stroke looks like a big chunk taken out. There was no big chunk taken out. What there was this splatchy, diffuse decrease in function, like the brain was under attack by something from all over. In other words, this looks like either infection or toxin. And when I dug into these cases more, I kept seeing that these were patients who presented with all of the symptoms of chronic fatigue syndrome. They were tired all the time. Their sleep was terrible. They woke up. They were already tired when they woke up. If they did too much in a day, they would crash and be wiped out, just physically ill for the next couple of days, what's called post-exertional malaise. So all of that together said, wow, this is some sort of infectious process. Well, it turns out there's solid evidence from work by Dr. Lerner showing a connection between herpes 4 and chronic fatigue syndrome. Herpes 4 is called the Epstein-Barr virus. It's the cause of mononucleosis. We all act like it's a benign thing. Oh, you get mono and it goes away and everything's cool, you're fine. But herpes 4 and herpes 1, the cold sore virus, are all part of the same family. The other member of that family is chickenpox. Chickenpox is herpes 3. If you get chickenpox as a kid, you're sick for a couple of days, it's a benign illness, it goes away, all is good. But we now all know that decades later, it comes back as shingles. And where was the virus all that time? Hiding out in your body. So that same lifestyle of chickenpox is the same lifestyle as the cold sore virus. You get cold sores once, you have cold sores the rest of your life. Epstein-Barr, same thing. The doctors say, oh, well, you had mono, you're done with it, you can't get it again. No, wrong. Absolutely. How can they have, they're the same family. How can herpes 4 act differently than herpes 1 and 3? And it's ludicrous, but this is like medicine swears by this stuff. But the reality is herpes 4 is a cause of chronic fatigue syndrome. And in many patients who have treatment-resistant depression, when I put them on an antiviral, their depression goes away. So a long-winded answer, I know, but it was important to fit a lot of stuff in here. Infections are an important piece of psychiatry and neurology that we have been ignoring.
Ooh. Can you please say that again?
Absolutely. So we now know that infections are a vital part of Alzheimer's disease. We know that infections from the gut are a vital part of Parkinson's disease. We know that infections drive multiple sclerosis. We know that infections are a part of depression, because I've shown that in my own work. We know that infections, in particular Epstein-Barr, which is herpes 4, and another virus, herpes 6, are responsible for chronic fatigue syndrome. And when I treat my chronic fatigue syndrome patients, a lot of things get better. Their seizures go away. Their anxiety gets better. Their depression gets better. Besides the fact they have lots of energy and go back to living normal lives. So infections are a part of psychiatry and neurology that medicine has ignored.
Oh, very powerful words, I've been learning a series of things ever since you started talking, Dr. Theodore. That's amazing. Okay, so to bring this to an end, Dr. Theodore, what would you like to leave the audience with, like a final thought? And to those ones who would like to reach out to you, learn more about what you're doing, and you see, maybe you said some things that resonated with them and would love to learn more, like the infrared light. How can that be possible?
Okay, absolutely. So I'll start with how to reach me. So the website Neuro-Luminance.com. So neuro, Neuro -luminance, LUMINANCE.com. Or if you prefer, healmybrain.info are two different ways that you can access our website. A lot of what I'm talking about, I've also put into a book, and the book is called Brighter Days Ahead. And Brighter Days Ahead focuses on depression. And it uses ketamine as an example, but just to really illustrate the fact that brain repair is really the secret to a healthy brain. And I talk about other things that factor into causing depression, including traumatic brain injury. So what's the message I want people to walk away with? And that message is really, let's focus on the infrared light. As you said, light is knowledge. And right now, we're on the cusp of starting to use infrared light as a treatment. And and I encourage people to look into it, but you have to be careful. These low power home devices don't get through the scalp and skull and into the brain. There's no way. They don't even get through human skin. You have to use the more powerful infrared light, such as what we do in our clinic, to actually reach the brain. We went into the laboratory and showed this is how much energy you need to get through scalp and skull and 3 centimeters into the brain. We documented that, how to do that effectively and safely before we ever touched a patient with light. So that was our mission, was to figure out how to really treat the human being, not take what worked on a mouse and stick it on a human head and expect to get the same result. because, like, my skulls are kind of thin, right? So my message is infrared light is the treatment modality of the future. And I think the future is now.
That's right. That's right. That's right. You see, I think it is a must for me to read your book. What's the title again? What's the title of your book?
Brighter Days Ahead.
Brighter Days Ahead. What a powerful topic. Oh,
Brighter Days Ahead.
Beautiful, beautiful cover. Okay, got it. Okay,
and
so it is
it's available on Amazon.
Okay.
Yeah. Mm-hmm.
Yeah. What about your website? On your website, is it on your website too?
There's a link on the website back to Amazon. Yeah. Mm-hmm. Yeah.
Okay, beautiful.
So it links back to Amazon.
Okay, amazing. So that's going to be the end of the show, Dr. Theodore. Thank you for, oh man, where do I start from? You said so many amazing things, I tell you. I would have to listen to our conversation over and over again because, amazing. Thank you so very much for coming and sharing those amazing words with us. It means a whole lot. Thank you.
You're welcome. Thank you so much for having me.